It is important to note that all sorts of causes, that is, loss of blood or fluid, or sepsis, anaphylaxis, hyperthermia, or pulmonary edema, as well as myocardial infarction, these all eventually lead to shock state that usually shows the following path. The first two causes may lead to hypovolemia, and a second cause can lead to vasodilation. Hypervolemia gives rise to the symptoms of thirst due to lack of fluids in the body. Vasodilation and hypovolemia both will lead to decreased cardiac filling that is also observed in pulmonary edema. Now, myocardial infarction will cause a decrease in the cardiac contractility and cardiac output will be lowered. Now, this can be observed in all the causes. This eventually will lead to lowered blood pressure that produces the symptom of hypotonia. This will give rise to hypoxia that causes organ damage. That is kidney, lungs, and our gastrointestinal tract. You must know that sympathetic tone will be increased, that will have increased heart rate, and you will observe it as a symptom. Now, sympathetic nervous system will cause vasoconstriction of the skin, which provides you with the symptoms of cold sweats and pallor. But pallor will not be shown in the case of sepsis, so do remember this. Note that the vasoconstriction will also cause hypoxia. And if you observe closely, you will see that vasoconstriction is counter-regulating reduced blood pressure. And similarly, increased heart rate is counter-regulated with a decreased cardiac output. This counter-regulation causes circulatory failure that will lead to irreversible shock. So this brings us to the end of this video. We quickly went over the types of shock, the underlying causes, and the consequences that may be observed. To learn about shock in more detail, watch a full lecture on sqadia.com and upgrade your knowledge within minutes. So have a nice day and stay tuned to sqadia.com to learn more every single day.